Okay, we're just gonna put sleep. Okay, so try to sleep now. You have medication on body to get you drowsy, okay? You will just feel me just fidgeting because I have to be monitoring.
You want more ice, Mom?
Sure, sure. I'm gonna get you a cold compressor because I see you sweat from it. Okay, and I'm gonna bring them.
Okay, so it's been 2 weeks since the heart surgery. Since I had the heart surgery, it's been 2 weeks, almost exactly 2 weeks and a day. And the surgery went very smoothly. I didn't have any problem. It lasted like approximately 2 hours, but everything was very, very fast. They intubated me, and I think at the beginning that was the hardest part. Once I came through from the anesthesia, I felt like this, like I was like choking, and it was because of the tube that I had down my throat. But they took that right away off, and after that, yes, I had like a pressure like in the middle of my heart, like here. It was like strong pressure, but it wasn't like a big deal. And then as the anesthesia wore off, it was a little bit stronger, so they gave me some medication for it. They gave me oxycodone, I think it's called, for the pain, like every 3-4 hours. And another problem that I had, but that's because probably it's the anesthesia, I was throwing up. I was throwing up like a few times, but they gave me medication to calm that down, and which it did. It would come back after hours, but I mean, compared to what I had been through, that wasn't a big deal. The throwing up, and after they took the tube out of my throat, everything was good. I was able to comprehend, talk to my kids. They would not give me anything to eat right away. They gave me chips of ice is what I was chewing on, and that really, it was good for my stomach. And then let me see what happened after that. They said sometimes when you come out of the anesthesia, your brain is kind of foggy, And mine was a little bit, the only one I couldn't remember was my nurse. And it was funny because I would see her like the next day and she goes, "Oh, my friend, how are you feeling? Remember last?" And no, I didn't remember. I didn't remember her. I remember what happened. I just did not remember her. But I do remember that she was there in my room that day or that night when I got out of ICU. No, I'm sorry, when I got out of the operation. She was there in recuperation and she was there in ICU with me all night long. She did not leave the room. And it's funny because the next day, I couldn't even remember her. I knew she was one of my nurses, but I didn't remember she was the one that was there with me constantly. And but everything went really, really well. After that, the pain was very tolerable. They would give you medication. After a while, I told them, no, I don't want any more medication for the pain. The pain is not that bad because I think it also affected my stomach, the pain medication. So I didn't want any more medication for the pain, and it was tolerable. And I was there after maybe like the next day. They put me in a regular room. No, 2 days after, because they didn't have a room available in the regular unit, the regular heart unit. So 2 days after the surgery, they put me in a regular room, and there I started. What do you call it? My heart started beating fast. Um, my heart started beating really fast, and then they gave me medication for that, and they gave me a potassium, and my stomach started turning again, and I couldn't eat anything. I mean, I love food. I'm a person that I love to eat. I eat anything. I mean, as long as it's not salty, I eat anything. But then they brought me breakfast, and the breakfast is like, oh my gosh, I looked at it, everything tasted salty to me. And I couldn't eat. That morning I couldn't eat. My stomach was overturned. But then after, uh, I would say maybe the following day, they kept me there overnight, one more night, because of my heart. My heart beating was really, really fast, and they had to control that. They said that that's perfectly normal. After a surgery like that, it's perfectly normal to have those. I forgot what it's called. I'm sorry. Later I'll find it and I'll put it somewhere here in the video. But after they controlled that, everything was fine. The next day or that night, I had dinner. The dinner was okay. I was still tasting everything salty. And the sweet, I could not eat any sweets. And in the process, I lost like 7 pounds, which is good because I had gained before surgery, like a few months before, I had gained maybe like 10 pounds, and with this process I lost 7. They said a lot of it that you lose is fluids, because you accumulate a lot of fluids. But um, I had no pain. I can say that after having such a major operation, I didn't have the open heart down the middle, but the incision is right here. Let me see. I'm going to show it to you. There's the incision there's the incision right there, and I have another one back here, which I think that's some tubes that they had through there, but this is the incision from here to here. That is it. That was my open heart surgery right there. And they replaced the valve with a little, well, not a little, but a regular cow valve. And in commemorance to that, I got this, which is a little girl with a cow, and it says, "Always in my heart." I thought that was cute. But anyway, after everything was fine, they took away the tube. I'm gonna show you where I had the tube for the drainage. It's right here. It's almost healed already. I still have a little bit of a bloody watery coming out, but just a tiny bit. and this here is like allergic to the tape. Apparently, after having the tape there for a couple of days, I made an allergic reaction to it. But the incision is curing. I mean, it's closing up really good. And when they took the tube of the day I came out of the hospital, they took the tube off. They took the tube. There were like a couple of tubes in there, and they took them out, and that was kind of painful because they pull them out, and you can feel them moving inside, and then one of them they just pull all out like really quick, and you feel like, oh my gosh, they taken out everything inside me. But after that tube was out, about 2 hours exactly, 2 hours afterward, it felt like nothing. It felt like I had not been in the hospital. It felt like I had nothing wrong with me. No pain whatsoever. And the only thing that I felt, I got out of the hospital that day and I was kind of like tired and like not out of breath. I can't say I was out of breath, but I was like feeling dizzy. I was feeling kind of dizzy. So I got home and I laid down for a while, but the pain, no pain. It's unbelievable how a major surgery like that and you have no pain at all. The pain that I was having in the middle of my chest was because of those tubes that I had inside me. And after they took those tubes, it's like, oh my gosh, I'm brand new. And yes, the day after that, and I was very tired. I would walk from my room to the kitchen and I was like tired. Not out of breath, but just like drained tired. So I would go back and lay down. Then I would go somewhere else if I had to go to the garage. Um, and come back and lay down a little bit. Yeah, a week after that, I know I shouldn't have, but a week after the surgery, I started driving because I had to go to my mom's house and I didn't want to depend on anybody taking me there. So, exactly a week after, I drove to my mom's house. And like about a week and a half after that, I went to the grocery store and did grocery for my mom, bought groceries for myself, and now it's been 2 weeks. 2 weeks and I feel really good. Yesterday I went to Home Depot. I know I'm doing things that I really shouldn't. I should take it easy, but I have I have more energy now. I feel better. I can be standing like for a while. I cook too. As a matter of fact, the day that I got home from the surgery, the day after, I was dying to eat split pea soup, and we went to a place here by my house to see if they had split pea. They didn't have split pea or lent or anything like that. So I told my son, let's get a bag of split pea and some pumpkin and pieces of meat, and I'm gonna make some. So I made some split pea soup the day after I came out of the hospital, and I was drinking that split pea soup for about a week. I don't know why. I just craved split pea soup. So that's what I had because now I could not eat anything else. Everything else was like, I don't know. I would find things salty, or I wasn't craving anything at all. So that split pea soup was heaven. And like I said, it's been 2 weeks already. And the other day I cooked at my mom's house. I cooked sausage rice. Came out really good. I had some of that. And my appetite is like increasing little by little. The things that I don't crave too much, which before I just loved. I would like leave a plate of food for sweets. But I'm not craving sweets at all. So what I'm getting is fruits. Fruits is what I'm really craving also. So I bought fruit. I made a fruit salad, and I've been eating fruit salad. Um, and besides that, I mean, everything else is great. I think I went to the cardiologist yesterday, and he was a little bit concerned because I have here on my groin, because I had some tubes in through there, and in my groin, I have like a bump. So he was a little bit concerned about that, and he requested for me to have a sonogram to make sure that it's not an aneurysm. And I don't think it is, because all of my arteries and veins are totally clear, no problem whatsoever. My lungs are working really good. I've been doing my exercises. Let me hold on just 1 second. Let me get my. Okay, so they gave me this at the hospital, and this is exercise that I have to do. I have to hold my breath. So I have to breathe. So I have to breathe in through this and make sure that this lever or this little apparatus in here goes up as much as possible. When I was in the hospital, I was only able to get it up to 1,000, and now I'm able to get it to 1,500 and hold it there for a few seconds and then let go. I'm gonna do one and show you. So take a deep breath. So you put it to your mouth and you take a deep breath. And you do that about 10 times. 10 times or 15, as many as you can. Lay down. Okay, and then I got this other one. And you try to do that every hour. I don't do it every hour, of course, but I try to do it at least twice a day. And then they got this one. This one is called a cappella. A cappella is basically the same thing as the breathing in and out, and it makes this fluttering noise. Let me show you. I don't know if you can hear the noise that it makes, but you breathe in and you breathe out right into it. It's called a cappella. And that you do like about 10, 15, like an hour. I do it twice a day. But my lungs feel really clear. I don't have any coughing or anything. No cough, or I don't have any phlegm, which is good. And what else can I tell you about this operation? The And the only thing I can tell you about this operation, if you need to get it done, go ahead and do it. Especially is with Dr. Lamela, Joseph Lamela. No hesitation. Go ahead and do it. You're going to feel a lot better. And the process is very minimal. Very minimal. Like I said, the worst thing that I noticed it was when I had the tube down my throat and they took that out within maybe half an hour after I started gaining consciousness. I don't remember, but more or less. So that's no big deal. They take that out right away. And another thing is when they took the drainage tube out, and that's just like a couple of seconds that you feel that pressure inside you, and then you feel great after that. No pain whatsoever. The lightheadedness, the kind of tiredness and weakness, yeah, that's gonna like go on for a while. But you just take it easy. You take it easy and rest. Take advantage of whatever, whatever. If they bring you food and pamper you, take advantage of it. Believe me. And this might be my last video, but if I have anything else going on, I'll make another video and let you in on it. Okay? I go to the surgeon for a follow-up on Tuesday. So maybe I'll make another video and tell you how that went. Okay? If not, please take advantage of the situation if you need to get that done. I can only tell you about the way I had it done, which is minimal access. It's no big deal at all. No pain, nothing. If they have to open you up, I can't tell you that, because I know that's it's a little bit more complex. But please take care and do what you gotta do, and let your doctor advise you and tell you, and follow his instructions. The medication they send you, take them like they should. Antibiotic, take them as you should, and I wish you the very best to everyone who has to have this done. And I know everything will go good. May God bless you, and I'll see you next time.